Hi, I'm Joni Michels for Winslow Facial Plastic Surgery Fusion Spa. From the moment you enter this Asian-themed oasis, you're transformed into a state of peace and tranquility. The Winslow staff of professionals offer technical expertise and artistic ability on a daily basis. Look no further to find the best in plastic surgery. She's right here in Indiana. Let's meet Dr. Catherine Winslow, a visionary, expert surgeon, and artist. Why did you decide to specialize in facial plastic surgery?
Well, I knew I wanted to specialize because I really wanted to be an expert in the field of one particular artistic talent. When I was a resident, I did my residency in Colorado, and at that point in time the Columbine massacre occurred, and one of my patients was a teenager who was shot at point-blank range in the face with a shotgun, and it was then my job and the job of my service to reconstruct him and give him not only function but some sort of cosmetic recovery that would allow him to go out and about in public. So we took a leg bone and reconstructed his jawbone so that he would have functional movement and teeth and could actually chew and swallow. And we took skin paddles and grafted new skin onto his face. So really he was left with a scar. And at that point I decided, this is really something special. This really drives a passion in me, and I decided that's what I wanted to do with my life.
You've treated White House officials, VIPs, dignitaries all across the country. How did that happen?
Yes, unbeknownst to me, one of my patients was actually very prominent in White House politics and completely did not know about it. He put in a good word for me, and they did not at that time have an ENT consultant to the White House, but after his recommendation went through the medical offices at the White House, they decided that that was actually a good application. So after talking with me and giving me an informal interview, and of course looking at my references and talking to other people whom I treated, they decided that I would be a good fit for that.
And your husband is in the service.
He is.
Did you meet when you were at Walter Reed Medical Center?
We actually met in ROTC in college. He looked very good in uniform. And we both stayed in the service since then. Right now he's the state aviation officer for Indiana. He still flies Blackhawks, and he's been in the military for over 20 years. I'm very proud of him. Out of all the things that I've done, I would say the thing that was the most difficult and most challenging for me was achieving the top score for the national board exam. When I took that, I was actually at Walter Reed serving as the chief of facial plastic surgery and decided that I needed that extra accreditation with the ABF PRS. At the time, I just had a baby, and I had all of my duties at Walter Reed and of course at the White House, so it was a matter of trying to study and juggle all these different positions at once. So I'm very proud of the fact that when I took the exam, I not only passed, but I got the highest score in the nation.
Share your concept for the Wellness Center.
I really wanted to start something where a patient can come to one center and get everything that they need with regards to health, wellness, aesthetic treatments, even Asian acupuncture. Anything that they need is provided here in one center. So I've been able to accommodate that by very carefully selecting the people with whom I work. And on the first floor of our building, we now have people who provide cosmetic dentistry. We have a workout health fitness center. We have a beauty salon that does hair and nails. We have family dentistry. We have a multitude of services that complement the things that I do up here. And in fact, we've been able to expand our salon and spa up here as well. It's called the Fusion Spa. We have been able to blend nicely ancient Eastern techniques such as acupuncture, and we've even taken that one step further. So our acupuncturist does cosmetic acupuncture for patients who aren't interested in Botox. She also does herbal therapies, and she is authentic and trained in China. At the same time, we offer the most up-to-date technologies in Western technology, such as laser treatments, chemical peels, Botox and fillers, and a multitude of things that are really hot and new on the market.
So it really is, it's a one-stop shop.
Absolutely.
Dr. Winslow, thank you so much. Dr. Winslow's office provides more Botox, Juvederm, and Latisse than almost any other office in the state of Indiana. One of those reasons is because of my friend, ace injector Tristy Roseborough, and this office is also a platinum provider. What are some of the misconceptions that you think are out there about Botox?
The biggest misconception about Botox is one little injection and you're going to be sick, because it is a toxin. The nice thing is it is a toxin that has been used in the body for well over 30 years, and it is well tested. It is very much diluted, so it's not going to harm you. It's going to relax your muscles and make you not look so tired, angry, aged, all of those things that we want to reverse.
And it seems like this is the growing trend right now. Rather than invasive procedures like surgery, I think more and more people are turning to the Botox and the Juvederm. And it seems to, because there's less downtime, right?
Yes, and baby steps into the cosmetic arena are a nice way for people to be introduced into it, as well as even after surgery. There are things surgery will never accomplish, or things that Botox and fillers help maintain. Once you have invested in your face, you want to keep investing. You want to maintain the looks that you've got. You want to maintain the smoothness to your features. And Botox and the fillers and all of the products in the cosmetic world to us allow us to do that.
What areas can Botox be used for? Obviously, I think most people are familiar with this area right here. But what other areas?
Botox is FDA approved for the deep furrows between the brow lines. Off-label use for it is just getting more and more prominent. You can use it to open up areas around the crow's feet. One of my favorites is treating what's called the bunny lines that help cause creases here. You can lift your eyebrows with it. You can soften the vertical lines going into your lips. The uses are ever expanding for Botox.
So there's absolutely no downtime with this procedure, right?
Absolutely no downtime. It takes 2 to 10 days to become effective. It is not immediate results, but they will progressively get better, and you peak at about 14 days.
Lots of times I have to be camera ready at a moment's notice, but I have a secret weapon. My good friend Shannon Reed, she oversees the Fusion Spa here at Dr. Winslow's practice, and you have taught me so much about the importance of getting on a good skincare system.
Thank you.
You really have. And ladies, I think one of the most important things that you want to remember is that you really need to practice this on a daily basis. Don't you think that that's the key?
You know, you do. A lot of people, I think, spend the time and the money, but then they go home and forget to continue to do what we've taught them. So then they find out that the products that they spend all this money on isn't working. So it's really just to make sure you get yourself on a good regimen, you understand why you're doing what you're doing, and you'll see that the products do work then.
And we're going to talk about some products right now. And these are products that, would you say, are good for really most skin types, whether you're dry, whether you're oily?
Absolutely, absolutely. The first thing that we always say here at Winslow is that you need to start with a good basic cleanser, something that works well. One of our favorite cleansers in the office is the Cleansing Complex by Is Clinical. We like it because, especially for someone like you who uses camera-ready makeup, it tends to kind of stick and stay on, and this will take all of it off very gently. We'll even take off that kind of heavy eye makeup and the mascara, and pulls it all off, and it does not dry out your skin. This is actually what we use during most of our skincare treatments in the office. And something that we have found is that the Clarisonic is known to cleanse the skin 6 times better than if you just use your hands or a washcloth. So use this morning and night, and it really improves your overall texture of your skin and how your skin just looks and feels.
And it doesn't dry your skin out. I mean, you can use this as often as you need to. I know I take off makeup constantly, and I use this stuff sometimes 2 and 3 times a day, and you're right, it is fabulous.
It really is.
So cleanser, that's very important. And then moisturizer?
Well, the next thing we like to do during the day is your vitamin C. As you know, that I'm a big preacher of vitamin C's for everyone. There's different kinds for everyone. But it really will fight off the free radicals. It will help with just environmental factors during the day. And someone who's in the lights and outside shooting, it's very, very important to make sure your skin has that kind of protection every day.
And then what else do we have?
And your next is going to be really, really the most important is your SPF. Okay. You know, years ago SPF 15 used to be fine to use, but day and age now and everything that's going on outside, SPF 30, anything less than that is really not going to do you any good.
Shannon's getting ready to do a dermaplane with me. What are the benefits of this procedure?
Benefits are I'm going to remove all the peach fuzz that's on your face. Everyone has it. It's called fine villia hair. It's actually what babies are born with. And it's a way for your body to help control temperature. But on the face, it's not really needed. And when I remove it, your skin is so smooth. It's gentle, it's an easy way to get some of that dead skin off, and your makeup goes on beautifully after I'm done.
It's like a flawless finish.
It really is. It's really something that any kind of makeup cannot do. It's amazing.
Now, I've often heard that they say that the hair will grow back thicker or darker when it's removed.
That's a common misconception, and something that 99% of my patients, when they first come in to see me, they worry about that. And I assure you that it's not the type of hormonal hair that starts to grow that becomes the darker, the little whiskers. It's not anything like that. It's very fine, very kind of fuzzy, and that's exactly how it grows back.
And how often should you get this procedure done?
You know, it really depends on, each individual is a little different. Everyone's hair grows, you know, probably every 3 to 4 weeks is common, but I have a lot of patients, just special events especially, they're in here a day or two beforehand, and just to give their skin that nice glow to it.
Now that looks like a blade.
It is a type of blade that I use. It's not anything like you would use a razor to shave your legs with. It is a little different. It is just a flat blade, and I hold it at a very special angle. I'm not going to cut you. It glides right over the top of your skin, I promise.
So it's as easy as that?
It is actually that easy. It takes a little bit of practice, and I've been doing it for quite a while, so I feel pretty confident that we're going to be okay with this.
And for questions, people can always visit indieface.com.
That's right. That's right. Any questions?
This Zen Den, as I like to call it, is home to a variety of services, from facial cosmetic surgery to medical spa treatments and skincare procedures.